You think you're paying for healthcare, something meant to protect your life when everything goes wrong. But what you're really paying for is not care. You're paying into a system that behaves more like Wall Street than a hospital. A system that tracks revenue better than it tracks recovery. A system that measures success in dollars, not in lives saved. This industry is not built to heal you when you're broken. It's built to invoice you when you're vulnerable. The moment you walk through those hospital doors, a meter quietly starts running. Not for time, not for treatment, but for profit. Every year, your payments go up. And every year, your coverage quietly shrinks. You pay more just to be told less is included. You pay more just to have more denied. You pay more just to wait longer for care you thought you already bought. And somehow, this has been normalized. Somehow, we've been trained to expect financial pain on top of physical pain. As if sickness wasn't enough. As if fear wasn't enough. As if losing your health wasn't already a full-time emergency. No one ever explained when health became a luxury product. No one ever told you when survival became a monthly subscription. No one ever warned you that getting sick in America could cost more than going broke. But here you are, paying, renewing, hoping you won't need to use what you're forced to buy. Because deep down, you already know something is wrong. You can feel it every time a bill arrives that doesn't make sense. Every time a claim disappears into a bureaucratic black hole. Every time you realize the system knows your credit score better than your condition. And still, nobody ever tells you why it's built this way. Premium, deductible, copay, coinsurance, network. The words sound clinical, technical, and necessary, like part of some medical ritual you're expected to trust. But they are not just words. They are toll gates, placed carefully between you and care. And every gate opens only after you pay. Every term is another lock separating you from treatment. And every lock has a price hidden behind it. The language is complicated on purpose, not because healthcare is naturally complex, but because profit likes fog. Because when you can't clearly see the system, you can't clearly fight it. Confusion is currency, and the more confused you are, the safer their money becomes. You think you're insured, but what you're really holding is a conditional promise that disappears the moment you actually need it. A promise written in fine print instead of plain truth, designed to expire exactly when you're most desperate. Your card says, covered, but your contract says, it depends. And that gap between the two is where billions of dollars quietly disappear every year. You only learn the rules after you've already broken them, and you only find the limits after you've crossed them. You discover what's not included only when you're standing there vulnerable, waiting for answers that never arrive. Your policy is not a shield. It's a maze built to waste your time, your energy, and eventually your savings. And every hallway in that maze leads to another office, another form, another delay that quietly drains you down. This is not confusion by accident. It's design, because a system that is easy to understand is hard to exploit. And a system that is hard to understand is easy to monetize. So they give you words instead of clarity, forms instead of answers, hotlines instead of help, and appeals instead of accountability. By the time you finally understand the rules, the bill has already arrived, not from your doctor, not from your nurse, but from a corporation that never even saw your face. Because in this system, the fine print collects long before the doctor ever does. Hospitals don't charge more by accident. They charge more because the entire system rewards higher numbers. They raise prices not just for medicine or machines, but to build negotiating power before the conversation even begins. They charge high, so insurance companies can pretend they are saving you money. Those discounts on your bill are not gifts. They are theater. They are strategy. An inflated price makes a reduced price look like mercy. But mercy was never part of the design. Insurance companies are not in the business of paying claims. They are in the business of managing when they don't. So they delay. They request more documents. They send you in circles. Not because they need information, but because they need time. Because every delay earns interest. Every week they hold your money, they grow it somewhere else. Every denial keeps cash inside the system longer. Every denial also teaches you something quietly and carefully. That fighting back is expensive. That appealing is exhausting. that quitting is easier. And every appeal you abandon becomes profit. Your pain is not their emergency. Your deadline is not their deadline. And while you wait on the phone, profit is moving without you. Hospitals inflate, insurance negotiates, pharmaceutical companies mark up, and the patient is billed for all of it. Not because there is no other way, but because this way makes the most money. This is not broken design. This is optimized design. The machine is not malfunctioning. It is performing exactly as intended. Health insurance is not health care. It is a financial system built to move money, not heal bodies. It's a product sold with medical language, but engineered with corporate logic. You don't buy protection when you sign that contract. You buy access. You buy conditions. You buy limits. You buy permission to be charged at every step. You are not paying for certainty or peace of mind. You are paying for conditional survival. What you own is not safety. What you own is risk management, a subscription to uncertainty disguised as security. You don't fail this system when it overwhelms you. The system succeeds when it does. It was built for you to fail slowly, quietly, legally, to bleed money without ever seeing where it goes, to confuse you without ever explaining why, to keep you paying even when you are breaking. And the hardest truth is not the cost. It's what the cost is teaching you. It's teaching you that sickness is a liability, that survival has a price tag, that health is something you rent, not something you own. You were told this system would protect you, but it doesn't protect lives. It protects margins, it protects quarterly earnings, it protects the machine, and you were never meant to understand it, because if you understood it, you would never accept it.